Leadership's been described as keeping out of step when everyone else is marching to the wrong tune. And as you introduced your mark last week, I couldn't help but notice that it was criticized from the left, it was criticized from the right, and some folks from the press said, well, what do you think of that? And I said, well, sometimes when you get attacked from either end of the political spectrum, it means maybe you've come to a pretty good starting place, and I think we have. And I like to paraphrase Churchill, who used to say, this is not the end, this is not the beginning of the end, this is the end of the beginning. And I think when we finish our work at the end of this week, and I hope to report out a bill with bipartisan support, that it will be the end of the beginning, with a lot of work still to do. As most of my colleagues know, I go back and forth to Washington on the train just about every day, and I go home just about every night. And before I catch the train, the 7:19 train in the morning, I usually stop at the Central YMCA and work out, and try to work out every day of my life. I drove today past the Wilmington Hospital on my way to the Y. And as I drove by the Y, I was reminded that, as I drove by the hospital, I was reminded last night that, and frankly every night, and just about every day of the year, every day and night, people line up at that hospital, use the emergency room. They use the emergency room because that's about all they have. The care that's provided for them is care that we say is provided for charitable reasons. As it turns out, we pay for that. And every one of us who has health care coverage pays about, in this country, every one of us pays about $1,000 apiece to provide health care for those who don't have it.
Just anybody.
I went to the Y this morning. I got dressed and went up to the fitness center. I got on one of the bikes and started riding the bike. And as I rode the bike, I was trying to multitask, and I read, got into the new issue of Business Week. And there's just one little scribble here it's in the executive summary on page 5, and it says, the cost of health. I'll just read it. It's real short. It says, and what if Congress doesn't come through with sweeping health care reforms? That's the question. And it goes on to answer. It says, annual health care costs for business will soar 166% over the next decade. It's $29,000 per worker, says the Business Roundtable. That's even worse than the prior decade when costs shot up by 131%. About an hour or so after I'd read that article in the Business Week, I was on the train. I was on a train heading down here. And as we passed through Newark, Delaware, I looked out the left side of my window, and I saw a Chrysler plant that I worked for 29 years to keep open. It's closed. 4,000 people who worked there not long ago don't have jobs anymore. 12 miles up the road is a GM plant. It's closed too. It closed 3 months ago. 3,000 people who work there don't have jobs anymore either, and eventually they may not have health care. And it's not just big companies like GM and Chrysler going bankrupt. There's little companies, middle-sized companies all over this country that are finding it harder to compete. And we need to do something about that. A bunch of us did things during the recess where we had listening sessions, telephone town hall meetings, regular town hall meetings. And one of my sessions, I had a guy who said to me, he said, we have the best health care coverage in the world. And I said, not to be disagreeable, sir, but we don't. We spend more money for health care than any nation on earth. We don't get better outcomes. And like Senator Stabenow just said, 14,000 people are going to wake up today with health care coverage, won't have it when they go to bed. Over 40 million people don't have any health care coverage. We help pay for them in places like the Wilmington Hospital that I went by this morning. Got big companies left and right, little companies going bankrupt, unable to compete in the world today. And instead of trying to figure out what do we do about it, too often around here we get caught up in really inflammatory issues that frankly don't contribute much to reining in the goal of the health care cost and extending coverage to people who don't have it and making us competitive in the world. The death squads, assertions of government takeover. I'm not interested in that, and I think my colleagues know that I wouldn't support that sort of thing. Issues like abortion. Abortion is not provided for. We don't fund abortions in this legislation. Somehow saying that we're going to provide coverage to illegal aliens, we do just the opposite in this legislation. And rather than focus on what divides us, why don't we focus on what unites us? And there's plenty in this legislation and plenty that can be added to this legislation that I think will unite us. I just want to mention, some of my colleagues get tired of me talking about being a recovering governor. I am. And I like to focus on what works. And I just want to talk for a couple of minutes about things that actually work to rein in the growth of healthcare costs and provide better outcomes. One of the questions I've been asked a lot this year is, why can't we have the same kind of healthcare coverage that you have, Senator Carper? And I say, well, it's not a bad idea. We have a federal employee health benefit plan. But you know what it really is a large purchasing pool that 8 million of us get to choose from. And it's all private plans that we choose from. Our administrative costs, 3% of premiums. And if we can't get everybody to join that, well, why don't we try to replicate it? And that's what you've done in creating the exchanges, either on a state-by-state basis or a regional basis, and maybe by doing it on a national basis. That works. Large purchasing pools. And a bunch of people on this committee and aren't on this committee have been pushing for that for years. What else works? I went up to Cleveland Clinic a couple of weeks ago. I shared with some of my colleagues what I saw, and I've given all these speeches about the Cleveland Clinic. I literally went to see if actually what they do is what I've been saying. As it turns out, the two married up pretty well. They focus on primary care. And it's not just Cleveland Clinic, it's Mayo, it's Geisinger, it's Intermountain Health, it's Kaiser Permanente, it's that big co-op in Senator Cantwell's state. What is it called, Group Health? They all focus on the same thing. They provide a great template for us. They focus on primary care. They focus on prevention and wellness. They coordinate care. They focus on managing chronic diseases. Everybody there, all their patients have electronic health records. They've gotten rid of fee-for-service. The docs are on salary. They're basically in business doing the same thing the same way, and they get better results, and they get it for less money. What else works? Well, competition can work. And a great example is Medicare Part D plan, the prescription drug program. We had a huge fight, as some of you recall. Should we have a public option in the Medicare prescription drug program? And what we said is, if we end up with states that don't have any competition, we'll provide that competition. Senator Snowe and I have spent a lot of time talking about pushing for fallback plans and that kind of thing. We've never had to use the fallback plan in these states in the Medicare prescription drug program. We have dozens of prescription benefit programs in every state. Patients like it. Seniors like it. They've been under budget 4 years in a row. Well, what else works? Well, we could do things about defensive medicine. We've done it in my state. Used to be if Dr. Cantwell, if Senator Cantwell were my doctor, I didn't like the work that she did in treating me. I used to just go right into court and sue her. I can't do that anymore. I got to go before a panel, an expert, and make my case before I can go into court. And dozens of states have done that. I like the idea of what they're doing up in Senator Staben's way in Michigan, at the University of Michigan on Sorry Works. That's a good idea, and that's something I like the idea of trying health courts, where the people who serve on the courts are actually doctors or medical experts. I like the idea of saying if somebody follows best practice guidelines, that maybe what we should do is provide them a safe harbor from lawsuits. And what we're going to do, we can't do it in this committee, but I hope a lot of my colleagues, Democrat and Republican, who care about this issue, who know that the fear for defensive medicine sort of feeds the fee-for-service conundrum that we're into, that you'll join me and a number of our colleagues and say, let's use the states as laboratories of democracy, test what works in some of the states, become informed by that, and encourage it to be spread to other states, reduce the cost of defensive medicine, reduce the amount of time we spend in courtrooms on medical malpractice, and improve health care outcomes. I'm almost done, Mr. Chairman. What else works? We know if we incentivize people to take better care of themselves, we can rein in the growth of health care costs. A lot of people used to think that Safeway was just a supermarket or a grocery chain. As it turns out, they're a healthcare delivery system that's figured out how to incentivize people to take better care of themselves, and they have flatlined their health care costs for 200,000 employees in the last 4 years. It works for them, it works in 30 states, and there's a bunch of companies that are doing the same thing, and we can learn from them. Last point, what works? Prescription medicines work. They don't work for everybody. They don't work for people who don't have the ability to get the medicines. They don't work for people who actually get the medicines but don't take them. And sometimes, and we've learned by mapping the human genome, we've learned that not all of us is made the same. God makes us differently. Some of us in medicine will help some of us. It won't help the rest of us. And what we have to be smart enough, and Senator Wyden suggested that we do, is figure out how to use mapping the human genome, figure out which medicines are going to help us. We'll spend money on those, and which ones won't. And we won't spend that money. And that will work, and it'll help save money. Last thing I want to say, Senator Enzi's over there. I see Senator Enzi's talking to Senator Roberts. I want him just to look at me for a second. Senator Enzi is one of my favorite people here. And he and I sometimes talk about the 80-20 rule. He explains why he and Senator Kennedy were so successful in getting so much done in the Health Committee in recent years. said we agree on 80% of stuff, 20% of the we don't agree with, talking about Senator Kennedy. He said we just decided to focus on the 80% we agree on. We need to do that here. And Senator Enzi and I also, once I was presiding several years ago, he was on the floor and he was talking about his core values. He was talking about his core values. And I listened to him talk about his core values and I said, those sound like my core values. And pretty much here's what they are. First of all, figure out the right thing to do. Just do it. Don't do the easy thing. Don't do the expedient thing. Just do the right thing. And that's what we're trying to do here. Second is treat other people the way we want to be treated. Put ourselves in the shoes of the person who doesn't have any health insurance coverage, the doctors, the nurses, the companies that are paying for it, the taxpayers that are paying for this stuff. Put ourselves in all their shoes as we debate this legislation. Number three, if it isn't perfect, make it better. That applies to this legislation. It also applies to our health care delivery system. It isn't perfect. We can make it one heck of a lot better. And the last thing is just don't give up. Just don't give up. And on the left of why this morning, a lady said to me, Mr. Chairman, as I was leaving, she said, don't y'all start your markup today in the Finance Committee on health care reform? And I said, yes, ma'am. She said, I want you to know I'm praying for you. And I said, well, that's great. I said, I appreciate that. We all appreciate that. And I just want you to keep praying. And you know what she said to me? She said, I'm going to keep praying. I want to make sure that you keep working till you make this, fix this system and get it right. And that's what we're going to do. Thank you.